Welcome everyone to another episode of TAYFFI Talks presented by Truly Alive Youth and Family Foundation's COVID-19 Response Program. Today's theme is mental health and COVID-19, supporting children and families move forward with school and work during the pandemic. Today we have two guests, Margarita Sysing from Aspire to Counseling and Tanya Negrey from Tanya Negrey and Associates Art and Expressive Therapies. Margarita is a registered social worker in Saskatoon. She has a Master of Social Work from the University of Regina. She presently works as a clinical social worker for youth mental health and addiction services with Saskatchewan Health and Aspire to. Margarita has extensive experience working with children, youth, and families, with a special interest working with immigrant, refugee, and Indigenous peoples. She is dedicated to working from a feminist, anti-oppressive framework and truly believes that people are experts of their own lives and futures. Personally, Margarita is a first-generation Canadian with Filipino and Chinese roots. She is a proud single mom of a biracial 7-year-old Filipino Haitian son with autism spectrum disorder. Margarita takes pride in her role and commitment to the community as a social worker. Tanya is a Saskatoon-based art therapist in practice since 2000 and has been providing on-reserve art therapy services since 2015. Tanya earned a Bachelor of Fine Arts in Studio Art at the University of Saskatchewan, as well a Bachelor of Arts in Psychology. From there, she traveled to Chicago to combine the two fields, completing a Master's of Arts in Art Therapy from the School of the Art Institute of Chicago. Tanya has worked with many different populations in Chicago, Saskatoon, and other parts of the province. She feels blessed to call art therapy her profession, work, and calling. Working with people creatively is always rewarding for Tanya as every client brings their own perspective and experience to each session. She feels it is an absolute privilege to work with children, youth, and adults through their natural creative spirits. And of course, TAYFFI, Truly Alive Youth and Family Foundation, Inc., is a Saskatoon based nonprofit organization that provides support services for youth and families, especially members of vulnerable populations, in order that they feel empowered and become engaged and contributing members of their respective communities. I am the COVID-19 Response Program Coordinator and your host, Candace Fox. And without further ado, we will jump into this very important discussion. All right, thank you so much, Tanya and Margarita, for joining me today on this super important chat about back to school anxiety with kids. I know I gave a little brief introduction to both of you, but maybe you want to just tell me a little bit about yourselves and your modality, maybe the organization that you work for as well. And sure. I'm going to just start with Tanya because you're on the right side of me, so we'll start with you.
Okay, thank you. Hi, I'm Tanya Negrey. I have my own private practice. It's Tanya Negrey and Associates Arts and Expressive Therapies. It's kind of a long one. And my practice is kind of a contract-based practice that goes into different First Nations communities. So I have subcontractors in my practice as well. I'm an art therapist, and I have another art therapist, and I have a music therapist. So we are the Expressive Therapies team. I've been a practicing art therapist for 20 years. I did my Master of Arts in Art Therapy in Chicago in 2000. I lived 8 years in Chicago. I got lots of great work and life experience in Chicago. Previous to that, I did my undergrad work here at the U of S. I am a Saskatoon girl, so that time in Chicago did not keep me away from coming back home. So you can't get the Saskatoon out of the girl. You can't. So yeah, we work with all ages, from child through youth, through adult, through elder. We work in culturally based modalities. We try to always be sensitive to the community we're in, and no two First Nations communities are the same either. They'll have their own beliefs and ways, and we try to work in concert with that and using the modalities of art and music. So we art just a little bit, tiny bit about art therapy. It is like a form of psychotherapy, but it uses art as well in the session. So it doesn't just rely on words. So we are trained psychotherapists, but we are able to use these other materials in the session that both allow the client to express feelings or thoughts or anything really. And also it's a way to sort of have another perspective on a problem, because art gives physicality to problems. So it's always really fascinating work. No 2 days, no two clients are ever the same. And I won't speak too much about my music therapist because she works a little bit different, but she works a lot with autism and brain injuries and developmental delays and that kind of work. It's a lot of brain work.
Super impactful though. Wow.
Yeah. I was in private practice here in the city. When I came back to Saskatoon was 2006. And I've been in private practice ever since then, but I've given up my office to just work on the reserves because I just got so much work. I have more work on the reserves than I can keep up with, which is why I've brought on other workers to help. But I hope to have another office in the city again in the new year, so I can still, because I still get requests from people in Saskatoon for art therapy, and I'm not able to accommodate that. So it's a little frustrating. Yeah.
Bounce back and
Yeah.
forth again.
Yeah. So that's a little about me.
Lovely. Thank you. Margarita, a little bit about yourself and the organization you work for.
Sure. I'm a registered social worker. I'm a clinical social worker. I'm working in private practice with Aspire 2. This is a new role for me that I just started earlier this year. But my background in social work is quite diverse. I did my BSW in 2007 and then completed my Master of Social Work in 2013, both from the University of Regina. And when I was focusing on my work in the community and also in my MSW, I had a particular interest working with immigrants, refugee, and Indigenous families, looking at how mental health practice looks different with that population and how we can better serve that population when it comes to mental health concerns. So I have a pretty diverse background. I've worked in both community-based organizations and government organizations, and both in Saskatchewan and in Alberta. So it's pretty broad. I work more from a client-centered, strengths-based, feminist approach. I truly believe that clients are experts in their own lives, and I meet them where they're at. And so my work is very trauma informed. I do a lot of family therapy, and also I'm incorporating expressive arts into my therapy, which is new. So I have some training in therapeutic drumming, and I'm a musician myself. I've taken piano since I was young and grew up in the church and taught piano. And so I wanted to be able to use kind of the expressive arts in my therapy as well. So I do lots of elements of art. I'm not trained as an art therapist, but I would use elements of art and music and play, and then the therapeutic drumming in my sessions. So yeah, it's pretty diverse and eclectic, I would say. I guess my own interest, just coming from an immigrant family myself, first generation Canadian. My parents are originally from the Philippines, and just kind of seeing the struggles of our family, growing up and in Canada, and just the different ways that we navigate the systems is different. And so I like to use my personal experience to join with other families of diverse backgrounds.
I love it. A lot of synergies in the work that you guys are doing and the communities that you work in. So I think this is going to be a really great discussion. I'm really happy that you guys could join me today. I'm going to dive into the questions. I'm going to pose this one to Margarita first, but so we're about 2 months going into our 3rd month of schools reopening. What are some behaviors parents should be looking for in their children if they're feeling anxiety about going back to school or being in class right now?
Yeah, I think, it's a different back to school experience, right, for many families. If you think back at like the spring when we all had to adjust our lives to people working at home, school from home, and then once things started opening up, going back out into the community. So, anticipated, like I had prepared this presentation back in the fall and kind of thinking about how do you prepare parents for um, those challenges with the pandemic and the adjustments in school. So just kind of being aware of, if you notice anything different, then how they normally are, like any behavior changes, like excessive crying, if they're more irritable, if they're expressing not wanting to go to school, avoiding school, worry or sadness, being aware of even just kind of day-to-day things. Do you notice any changes with their appetite or their sleep? Those can be indicative of something else going on. And then also, like, if you notice maybe their lack of motivation for things that they usually would have enjoyed, any other extracurriculars, or it looks different in the school setting. They can't even really participate in sports in school setting, right?
Yeah.
So just kind of seeing, where they're at in terms of their motivation and mood and day-to-day stuff in the home.
Absolutely. Tanya, do you have anything to add to that at all?
I would agree with everything Margarita said, and I'd add to that to also watch for somatic complaints, because sometimes in children, mental health will show up in a tummy ache, or my chest hurts, or my throat is sore, my head is sore. So always to be aware of what is going on in their body, because often in kids, it's going to show up in their body because they don't yet have the words to say, I'm scared, or I'm terrified, I'm angry, all these different things. And kids' brains don't actually stop growing until their mid-20s. So an 11-year-old or a 7-year-old isn't going to know how to necessarily identify a feeling, and that a feeling might be driving something going on in the body. But yeah, you as parents know your children best. So anything that seems out of the behavior, or out of the normal behavior, but I would pay attention to all the things Margarita said, as well as their body. And just to try, I come from a feminist relational approach too, so try to keep in touch with your kids, check in with them. You can, like, don't be in there, it depends on their age. Like, I have a daughter who's 15 and she does not want me checking in on her 5 times a day. But if you check, you do it age appropriate, you check in and just kind of be on their level. Like, how's it going? What are you doing? When they have those structured moments with you, that's when information's really going to come out. So always paying attention to that relationship with your child as well is very important, especially now, because little mental health things can creep up and we don't know they're necessarily there.
That's a perfect lead into my next question. Anxiety and mental health doesn't discriminate gender, age, culture. Why is it so important, Tanya, that we nip this in the bud, especially with children early on, and do the due diligence and trying to get them the support so they're not growing up being anxious kids or whatnot?
Yeah, well, we have this thing we've come up with in the mental health field called adverse childhood experiences. And we call them ACEs. And so that can be anything from witnessing violence, any kind of trauma. And a trauma to a child can be pretty much anything that they experience as threatening or making them feel unsafe. And I think that ACEs haven't really looked at the pandemic and its impact on kids, but I'd say in some instances it can become an adverse child event. So it's really important to not have it grow into something bigger. It's like any illness, it's like any issue, you don't want it to manifest. So with kids, you always want to be on top of it as much as you can and in front of it, so it doesn't come a full-blown disorder or issue or obsession or whatever it can be. Yeah, and this pandemic's been real sneaky, just the way it snuck up and kind of blindsided us.
100%. And I think too, like kind of touching on what we talked about before with parents just being intuitive around their kids and just following that intuition, and if something isn't amiss, don't brush it off as just being childhood angst or teenage angst, but actually taking care of it.
Yeah, exactly. And I mean, some of it will be childhood angst or the teen angst thing too, but it's good to always kind of try to check in as much as you can, and when to give them space as well. So yeah, parenting is hard.
Margarita, anything to add to that at all?
Yeah, I think I think with mental health literacy, I think that's still quite a new concept for many families, whether in the mainstream society or when working with newcomer or Indigenous families. And so I think the more that we can encourage our kids to, be open to talking about these difficult feelings when they do come up, sharing good feelings when they come up, it's not a norm that we do generally, right? And with all this stuff happening in society, yeah, there's probably lots of questions that kids have or youth have that maybe they don't know how to express. And so, just being like you were saying, Tanya, checking in with your kids, letting them know that they can come to you anytime when they're having these big feelings, I think is really important. And for lots of cultures too, getting help isn't something that is normal, right? And still that stigma around getting help, whether it is for mental health or any type of practical support, they want to figure things out on their own. But, Canada has this wealth of resources that we can support these families that may need that extra help. And just knowing that we can be there to support them, I think is important.
100%. I almost feel like you guys are like, this conversation is going in the direction of my questions, because the next question would be, Margarita, what might be some seen and unseen barriers for newcomer or Indigenous children and families to reach out and ask for help? Because it's one thing to have all these things in play and the infrastructure there, but it's another thing when, newcomer families or Indigenous families don't know that they can receive that help, or internally there's some stuff going on that they don't feel like they're worthy of it.
I'm just going to speak to my own experience.
Yeah.
Growing up in the 80s, I guess I'm disclosing my age, growing up in the 80s. And, my parents came at a time, it was like the first wave of Filipino immigrants to Saskatoon, like late 60s, early 70s. And so at that time, it was really important at that time when Saskatoon was smaller, to connect to cultural communities. And there was more of a sense of like the Filipino cultural community.
Yeah.
They didn't access outside agencies. That was like, I think maybe the first settlement agency came in the 80s, but they didn't access it. They didn't know what it was out there. They knew that they had to get a doctor, they had to get a job. Like, things have really changed over the years. And so for these new families coming in who maybe had different experiences working with, healthcare or education systems, may see mental health as this system, this structure that, is it okay to ask for help? Like, what does it mean? Am I crazy? Am I going crazy? That mental health literacy isn't there because it's not the norm in their countries. So, understanding those cultural norms, of course, there's language barriers, there's so many layers that you have to look at when looking at, these families with different backgrounds. So, I don't know what more I can say about that. It's just, seeing where they're at, doing what you can with what you think would be most practical and helpful for that family, and building that relationship again, letting them know that we have some ideas, we'll work with them, but again, not forcing your ideals on them, right? They might not be ready for intensive psychotherapy.
It's complex, is what you're saying. It's complex. It's more complex probably than for us to, have that discussion, in the span of a couple of minutes. But Tanya, anything to add to that at all?
Yeah, it's absolutely something that is a huge ongoing issue on the reserves, is the barriers. I work in the health centers and the schools in the reserves, and in the schools it's okay because I can be kind of hands-on when I go in the classroom, but there is a lot of stigma around coming to the health clinic and seeing a therapist or seeing anyone, because the communities are small that I'm in. So I don't think that this is an exclusive problem to the reserves. I think it speaks to the larger problem of the stigma around mental health, and just the whole idea of going to ask for help and saying I'm struggling is still seen as a weakness, unfortunately. I mean, these talks we have are great and we have to keep having them, and until it's really instilled into the public knowledge that it's not a weakness to seek help and support for your mental health. Because, and I will speak with the First Nations belief of the 4 quadrants, and I believe in this and have adopted it in my practice, that our mind, body, spirit, and emotions are all connected. So we have to pay attention to all 4 of those and not one is more important than the other. So we have to understand and remember always that the mental is a part of that. And that's why with kids, you know, so often it'll show up as something somatic, like my stomach hurts is a common one, because there's actually, I think it's called the vagus nerve, is attached to the brain and the tummy, and it's carries emotions back and forth. So often emotional problems show up as stomach problems, which is fascinating. So yeah, there's barriers all over the place, but all we can do is keep offering resources, offering programs, like Margarita said, trying to fit what we think is best for the family or the client we're serving. I'm fortunate, I have a lot of flexibility in the community. So if a client can't come see me in the office, I'm willing to go to their house. And there's been, you know, some restrictions around that with COVID, of course, and it was easier in summer because we could meet outside and we could do eco art outside. It was pretty cool, and you know, have our distance. But now it's a little bit more difficult, but not impossible. So yeah, we're just always trying to find new ways and think up different resources, and try to always never give up, and always be asking the people you're serving what it is that they need and they feel they want. That's also an important discussion to have, kind of in an ongoing manner.
100%. I think too, a really great point that you both kind of made is, you know, meeting people where they're at, wherever that might be in the moment. And not necessarily expecting, you know, newcomer or Indigenous families to adopt the system and to know how to navigate the system. We ourselves, I have a hard time figuring out the system, let alone, you know, someone who's just landed in Canada, or, you know, an Indigenous person who, you know,
That's
let's face it, they've had their own, there's a stigma just with the Indigenous cultures in the healthcare system. And
oh, so many barriers. Yeah.
you know, so yeah, 100%. I think there's, you know, these discussions are great, but there needs to be work done in the system as well to make it more accessible to, you know, the people that really need it.
Yes, I agree.
Parents probably find it, much like we do, difficult to articulate kind of what's happening in the world. How can parents keep their children informed without invoking that fear that, you know, let's be honest, they might feel themselves? Margarita, I'll throw this one to you.
Okay, I'll speak as a parent. I'm a single parent to a 7-year-old boy who has autism. And so I navigate the system, I work in the system. It's challenging, right? And so when the pandemic came out and we had all these rules around quarantine and you know, talking about what is the coronavirus, I did it in a way that was age appropriate. So, you know, this is a virus that lots of people are getting around the world, right? And so, you know, giving like facts, but not, you know, super in depth, you know, just general facts of how to keep yourself safe, how to social distance, how not to spread the germs, right? And so I remember one thing we did at the beginning of the pandemic was he had to draw what coronavirus looked like. Just something simple like that. And, you know, using his imagination to see, okay, I have a science background, I have a background in microbiology, and I'm like, well, look at my old science books, try to draw something that looks like this. And, you know, let's see what you come up with. And he liked that, right? You know, he's not scared of it. He knows when we go out in public, you know, we have to wear masks. You know, it was to his level. And yeah, that all that information that's in the media is very overwhelming. I was getting very overwhelmed myself when all the numbers were coming out. And it's I think I heard someone say it was like a collective trauma. It's a collective trauma that our society is experiencing with this global pandemic. And, you know, if you focus on it, then it depends on how you respond to it, right? If I were to respond in a way where my anxiety was up and I was afraid and fearful of catching it, then my kid's going to adopt that same mentality around it, right? So if I do it in a way that is gentle and, you know, stating the facts and being playful about it, then he doesn't really have much anxiety about catching the virus. So of course, you know, whatever age level that the person is at, developmentally, what is safe for them to understand, I think is fair and differs from family to family.
Beautiful. Tanya, anything to add to that one?
I just think Margarita said it really well. And of course, you know, as a parent, you have to always take care of yourself first, and that's not selfish. I always like to use the analogy of if you're on an airplane, they always teach you if you have to get the oxygen mask on, you put it on yourself first, even though your instinct is to put it on your child first or your loved one. But if you're not taking care of yourself and taking your own oxygen, you're not as effective if you pass out. So it's the same. We as parents have to limit our own exposure to, because it's constant. You could have the TV on constantly talking about it. So it's important to choose a news source that is reliable and trustworthy. And I say limit your exposure to that as checking in once a day, whatever it might be for you. Like maybe it's when Justin Trudeau talks, or it's CTV News, or whatever you feel is comfortable for you, and just sort of get the facts and then turn it off. And yes, to always be very age appropriate to kids and be concrete with facts, and make sure that they understand the importance of wearing a mask and washing their hands, and how long do you wash your hands. And I've done art around this, so I'd like to help kids feel empowered. So I've done art that is empowered based, like they feel like they have some control over what is going on. So one thing I've asked them to do is to look at themselves as superhero against coronavirus. So if you were a superhero, what would you look like? And how would you fight coronavirus? So, you know, they feel like those skills they're using that are now everyday skills of hand washing and sanitizing and mask wearing and distancing and staying at home a lot those are strengths now, because those we're fighting off the coronavirus. So it's how you narrate and it's how you frame the information. It's very powerful.
I think too that both of you touched on that, that self-regulation, that, making sure that, when you're coming to your kids and talking to them, that you yourself are not dysregulated, because that's just they're gonna pick up on that right away. And if
so much.
Yeah, and if they know mom and dad are scared, then that's just gonna transfer on to them 100%.
Yeah.
Cold and flu season is upon us. There, has been some talk, and looking at the numbers, they are rising. If schools do shut down again, what are some ways or some activities that, mom and dad can engage with their kids just to communicate what's happening, so they're not, traumatized or re-traumatized by, everything shutting down again. And because we know for kids, it's a big deal. It's a big deal for them. Like for us, we have to adapt, but for them not being able to see their teacher or their school mates, it's a big deal. So I'll pose this to you, Tanya. What are some things that mom and dad can do if the schools do close again?
Sure. I just think it's, again, back to the relationship and being very engaged. So no matter what age they are, you can always include them in daily activities. Having a structure, or at least some sort of loose schedule that you follow, is important, because one really important thing that school provides is structure and regulation. And it's a structure they can rely on and depend on. So giving some of that, especially to the younger ones, is really important. And just having them involved in things like cooking together, or we're going to make a family painting, or we're going to make a family sculpture, or, and I can provide maybe some resources at the end of this for ideas on ways to be creative and things to do at home, because it's really actually endless, the things you can do. It's like, from baking bread to cookies to, doing foam art, or playing a game. You can even play a game with Skittles. There's a game you can make when you give each family member a different colored Skittle, and then each Skittle represents a question that you pose to the family. Like green, if you have green, you have to say your favorite things about the family, or if you have red, you have to have a favorite memory about the family. So just little things like that you can do in the day. And I think adhering to the schoolwork or whatever the school has in mind or is offering for the children to stay up with as much as possible. It's pretty endless, but it can also seem very overwhelming. And I think, when we're overwhelmed and we have response to trauma, and Margarita's so right, it's a collective trauma. So there's different responses to trauma, and that is like you fight, flight, you fawn, or you freeze.
Yeah.
The 4 F's, right? So we have to give ourselves some slack as parents too. We always think, we have to be perfect for our children, but we really just don't. We have to try our best. So, and some of us as parents are going to experience some of those responses to the trauma, like freezing up or wanting to run away or, whatever it might be. So yeah, I hope that makes sense and answers the question.
Absolutely. And to, if you do, either one of you have resources to share afterwards, I'll attach those to the video as well, and we can share them so, parents have access to that as well. Margarita, anything to add to that at all?
Yeah, I would agree with everything that Tanya said. Definitely if you're at home together, having some kind of routine, but being flexible around it, right? And letting the children or youth be part of like making that routine, I think can be very empowering for them. So it's not like mom or dad is saying you got to do this at this time, but they kind of are part of that planning too, so that they put together their ideas. And just that quality time, I think, is important. Whether it's playing games, making music together, craft, baking, exercise, doing stuff outside. Like you said, the activities you can do with your kids is endless, right? And, I appreciated the time that we did have with quarantine, working from home, trying to manage my son's schedule. I'll never get that time again, when you think about going to work in person and going to school in person. So yeah, we made the best of it. There were times where, yes, there was maybe too much screen time, but I cut myself some slack and said, you know what, he is fine. He's doing all right. And just kind of having that variety, right? It is hard. I think electronic use is hard to limit, but I definitely limit his electronics as much as I can. And then when it comes to like that social engagement with connecting with others, we're connecting here on a Zoom call. We did virtual chats with some of our friends that we would normally have play dates with, or some of our relatives in other provinces. So that was kind of how we stayed socially connected.
Perfect lead in again, Margarita. Both of you guys are just like, you're like pitching them up for me. This is too easy. Screen time. This is a really hot topic aside from, the pandemic and all this stuff. What should parents like? How should they maneuver and manage that? Because it's got to be really friggin' hard. You're cooped up inside. You don't want them to be on the screens too much. Like, it's pandemic everywhere, news everywhere, catastrophes everywhere. How should parents, manage that without feeling guilty? Because like, I can imagine it's got to be difficult for them around this time with screens. Tanya, do you want to take that one on?
Sure, that's a tough one because I have a 15-year-old, like I said, and I'm a single mom as well, single parent. And that is how she is connecting to her friends. And at that age, their peers are so important. And I know she is in school, but they're in the block system. So they can't, like, they have a little bit of socializing in class, but it's not like it used to be where they would see each other in the hallways and hang out in between and hang out at lunch. And that, and it's so important to her development to have those peer relationships right now. So that's been a tricky one. And I don't really hyper monitor her. She seems to be okay. Like, we check in and, another thing I wanted to add was to take breaks. Margarita, you touched on exercise. So I wanted to say, if you can take exercise breaks with your kids, that's one of the best things in the entire world you can do, because I cannot, and I'm a real preacher and not always a practicer, I'll admit, but one of the best absolute things for your mental health is exercise and being physical and going outside, and it raises your dopamine and your serotonin, and it's natural, and it's just like has an effect on the rest of your day, and it's tremendous. So even if you can get your kids away, like, kind of say, yeah, you can have your screen time, your downtime, but then we're going to do this, and let's do that. Or, like Margarita said, have them be a part of that decision. So what are we going to do now? Like, do you want to paint? Do you want to go for a walk? Do you want to cook? Like, just having those times in the day where it's a little balance as much as you can between the screen time and the activities, and Also downtime together that's not screen based, like playing Scrabble or a game of cards, you know, that's still also kind of mindless, but you're not on a screen.
Totally.
And I know my 15-year-old is on her screen late at night, but I would say try to limit it late at night because I think it interrupts their sleep, especially the little ones. But that's when my daughter seems to get really on with her friends and they'll FaceTime. And so I don't, it's been hard, I'll admit it, as both a parent and a practitioner, because that is a hard one. And it's just so immediate, you know, because she's got her computer, she's got her phone, and they're connected, they're chatting on there all day.
I can
You know?
imagine that.
Mm.
Margarita, anything else to add to that one?
Yeah, I think everything that Tanya said I would echo as well. Even just thinking of like how we've adapted to our work world virtually. Like I'm here looking at my tablet, and I had my phone that I was looking at the questions that you sent me. Then I have my laptop that I had that presentation, so I can refer to it if I stumble. So it's like all around me, right? And I can hear my kid outside my door watching TV. So you can't, it is around you, and that's what 2020 is. And I like what you say, like, yeah, when we were doing the online school and I was working from home, on my coffee breaks, we do body breaks. On our lunch breaks, we go for a walk around the block. And, you know, he's still young enough that I can be like, okay, we're going to go shovel outside. He's not going to really shovel, but he'll play in the snow while I shovel, right? So at least we're getting that quality time together. He's off a screen. He's being physically active, right? But yeah, it is super challenging, you know, depending on that age. And I remember saying to my son, I said, okay, now that school has started, you get 1 hour of electronics a day. And he just started bawling. I'm like, nope, you can only do that on the weekends. On the weekends, you can play those video games or whatnot. But during the week, you know, there's going to be a limit. And we're going to be practicing your homework. You're going to be doing your piano lessons. You're going to be practicing your reading, those kinds of things, and doing things that don't have to be based on electronic. But yeah, it is challenging. It's super challenging, very challenging for families.
Yeah, that's the hardest one. I like that you mentioned playing piano because musical is another one. It's really great. Like if you have piano or guitar or just like a wazoo, anything like the kids can play around with musically is good.
Hats off to you both, being single parents and like managing work. Like I have a dog, and like that's a lot.
But your dog's alive, and I'm sure he's very happy.
Like those walks in the middle of the day. No, I'm just joking. But yeah, hats off to you both, because I can't imagine doing what I'm doing plus having to manage schoolwork. So yeah, well, hats off to all parents, because this is, you know, and it's real, and it, you know, we keep talking about, you know, making sure that they're okay and stuff like that. And it's really, really important. It's reinforcing that, making sure that you're checking in with yourself, not just your kids, and managing, you know, whatever emotions are coming up for you, because, you know, I think it's good to just be authentic sometimes with your kids and just letting them know where, you know, where you're at in a safe and appropriate way. So if parents are noticing that their child's mental health is declining, what should they do? What would be some of the first things that they should do to kind of mitigate that? Margarita, I'll ask that one for you.
I think just knowing that, you know, if your kids are starting, if you notice kind of some of those symptoms that we talked about, any behaviors that seem not regular, or if they start to want to avoid school or seem sad, to just let them know that they can talk to you. I think just knowing that it's okay to have those feelings and it's okay to talk about them. You know, I have a lot of social story books, like childhood social story books, talking about emotions and that it's okay to feel not okay and what to do when you do have those big emotions. And so I think for myself, you know, if I'm feeling stressed or you know, I give some psychoeducation to my son and talk about the feeling thermometer and talk about, you know, feeling sad or mad or stressed. That's part of his, like, he knows that a little bit. He might not be able to use it very well yet, but he's aware that we can have those big emotions. And when we do, that's when we try to find something to bring us back down on that feeling thermometer, something to regulate us, something that's going to make us feel good, like music or exercise or playing together, right? But yeah, just knowing that it is okay to have those feelings, it's okay to feel sad and to be able to feel safe talking about it.
Love that. Tanya, anything else to add around that?
Yeah, I think that's all really awesome. And adding humor, I guess, if you can in any way, like if, you can't always laugh your way out of bad feelings, but sometimes if you do kind of lighten it up with a joke or a movie or, I'll sometimes, and I do use the technology, like I'll send my daughter a meme that I know she'll find funny and, kind of like lighten it up, because we can't underestimate as well the power of laughter and a good belly laugh and just finding things funny. Like we have two cats and one of them is hilarious and he's always doing funny things. And so having that moment where we can laugh and think he's funny those are important too. So, and to remind them that it's okay, of course, to have those feelings and that they will pass is something I've always tried to emphasize as well, is that all feelings are temporary, because we're constantly in a state of feeling something, and that no bad feelings last forever. Just like usually good feelings don't last forever, that life is a mishmash and it's ups and downs, and it's helping kids to understand that is part of life. And we're going to have to learn how to regulate and deal with emotions, the good and the bad and all of in between. So yeah, keeping that dialogue open. And I like the feeling thermometer. That sounds awesome. Yeah.
Just like throwing this to you guys, what are some things that you are seeing in your practice right now? In the news, we're seeing a lot of increase in overdoses. We're seeing a lot of increases in like mental health issues, just in your own practices, obviously, without giving too many details. What are you guys just seeing overall? Margarita?
I would say with like a lot of the children and youth that I'm working with, when schools came back to in-person school in September, they still had the option, right? They had the option if families felt comfortable sending their kids to school, following the guidelines of the province, they could go to school in person, but they still had the option of doing online or homeschooling. And so I think for, depending on the family situation, you might have certain reasons, family members who are immunocompromised, more at risk of getting the virus. Those may be some reasons why people want to keep their kids at home. But I find for many kids who struggle with anxiety already, that option can be good, because I guess there's pros and cons. Maybe I think that it's still a good way of learning. However, they're missing out on that social interaction, right? That in-person social interaction that is so important. And yeah, for lots of kids who were struggling with anxiety, especially school anxiety, that they didn't have anxiety when they had to stay home. They didn't have to face those stressors at home, whether it was academic or social situations that were increasing their anxiety, right? And so it's almost like avoidance. It's like you're avoiding that situation. You're still getting your education, which is great, but you got to look at that balance. Yes, okay, so you're doing online schooling, but you need to find something else that your child can interact with their peers, whether it's a virtual chat like this, or having safe play dates outdoors, right? Something where they're going to be interacting, because that is so important to their development, that you're not going to get from a screen. Like, you can't learn those skills from a screen, right?
100%. Yeah. Tanya?
Margarita, you did such a good job answering. I forgot the original question.
I don't know. I think I went on a rant and a ramble.
It was good. I was into it. I was just like, yes, I'm feeling this. I'm feeling this answer. The question was, can you just talk about what you're seeing in your own practice right now with
yes. Sorry. Yeah. I don't want to be dark, but unfortunately, there is an increase in drug and alcohol use. There is an increase in suicidal ideation, suicide attempts, domestic violence. yeah, it's not good. It's a tough time. And a lot of, I'm just talking kind of in real general terms, and a lot of my kids, I can't really access them right now in a one-on-one, but a lot of my youth do stay in touch with me on the phone, on the texting mostly. And I think a lot of them have also frozen up with that kind of response of just freezing. Like it's so overwhelming, they're frozen. And they're not maybe, there's maybe some emotional numbing going on. So it's just a way of coping, because, you know, it's really scary. And the communities I go to do have border control, and one has been in a lockdown because there was some cases on the reserve, and it's scary stuff. So yeah, it's all the things that you would see there being challenges with, there are definitely an increase in. So
I know that both of you have lots of resources to share and stuff like that. But if people just wanted to get in touch with you directly, if they just wanted to learn more about the work that you're doing or get in touch with you, what would be the best way, Tanya? What would be the best way for people to learn a little bit more about you and your work?
well, I do have a website. It's tanyanegreyarttherapy.com, and it has information there about me and my practice and what I offer. And I'm actually working on updating the website right now because it's a little bit outdated. So I will be having some changes coming up soon. And people are always welcome to call or text me. My number's on the site. I mean, can I give it out here? It's
Sure. Yeah.
It's 306-222-1262. So people can call or text me, and I'm really open. And I've never, in my experience, had anyone abuse having my number or call me, you know, at midnight. So it's totally fine. And I'm happy to help anyone in any way I can.
Beautiful. Thanks, Tanya. Margarita, how about for you?
Yes, our Aspire to website is updated. My background information is there, my contact information is there, my email address is there, and my work cell number is there as well.
Perfect.
So do you want me to give the website address maybe, or?
I'm going to share all that stuff. I'm going to put with this video, I'll put your website, for both of you guys, and contact information. So, you know, we don't have to be, you know, an intermediary to get to you both, because I know people will, I'm sure, will have questions or want to connect with you and whatnot. So, but I wanted to thank you both for doing this session with me. Great information to share, and I hope, you know, hopefully, knock on wood, that this doesn't last. But if it does, and we need to, you know, just update information, hopefully I can sneak you two again to share some time with me, and we can continue this discussion.
Yeah, sounds good. It was my pleasure to be here. Thank you for inviting me.
Thank you so much, ladies.
Thank you so much, Candace.
All
Great
right.
meeting you too, Tanya.
Yeah, good to meet you as well.
Take care, and thanks for tuning in.